Hey folks, if you have any questions for me, slide into my DMs here at Primary Care Pod. We'd be happy to hear from you and happy to address any of your concerns.
This episode of Primary Care is sponsored by Rugiet Health. More than just an ED treatment.
A question we got is, do I truly eat 80% of my diet as produce-based? And it's true. That portion of my diet comes from the produce section in the grocery store. So that includes typically nuts, fruit, vegetables. So I try to avoid anything that is from a bag or frozen, and so that it is fresh. And it didn't happen overnight. Go one step at a time. You know, for me, I started with donuts and went to Captain Crunch cereal, to then switching to almond milk instead of cow milk, to then switching to papaya. You know, it took steps. And so give yourself some steps so that you're able to follow through. You'll find that you are much stronger than you think. And when you stop being so closely aligned with these addictive foods, it's a lot easier to make better choices. What advice would I give someone who has never had success from using a pill form ED treatment? Well, have you tried Rugiet Ready? Because it's not a pill form. So that would be my first recommendation, would be something alternative. So either a sublingual method, which would be Rugiet Ready. You could consider talking to your doctor about injectable options. However, these do come with a bit more uncomfortable procedural administration. So you would have to inject yourself, which can be uncomfortable. And it is difficult to maintain that medication. It has to be refrigerated. So really it depends on your lifestyle. It depends on your past medical history. It depends on what you've talked about with your doctor. It depends if this is a hormonal problem. Maybe this is more of a psych related issue, because if the medication that you're taking, pill version, is not effective, there has to be a reason. So either your ED symptoms are severe, or either your ED is caused by something that is not vascular or going to respond to those types of medications. So ultimately, it's going to be best for you to talk to your primary doctor or whoever a prescribing provider is for you, discuss these symptoms so that they can best determine what will be a great method for you to improve your ED symptoms and get you back to having healthy, wonderful sex.
What if injections don't work? Is there anything out there that can help ED?
Great question. So if injections are not working for you and you haven't tried Rugiet Ready, that would be my next recommendation, as we do have many patients that have tried injectable options for ED that have not worked for them, and they have found success using Rugiet Ready. It's very difficult for many patients to inject themselves, so it may be the administration that is incorrect, or it may be just that your body is not responding to that medication well. So talk to your primary doctor, talk to your ED prescribing provider, or reach out to us at Rugiet Health. We'd be glad to discuss your concerns, see your medical history, and determine if Rugiet Ready is appropriate for you.
Add us on Instagram at Primary Care Pod. Catch up on past episodes and don't miss out on new ones. Subscribe to the podcast on YouTube, iTunes, and Spotify at Primary Care Pod.